in King's College Hospital, we've been delivering the CAR T-cell programme since 2019. As part of my academic foundation programme research, I've been looking into the outcomes of the patients that go to critical care following their CAR T-cell infusion. So we looked at around 137 patients who'd been infused over 4 years from 2019 to 2022, to the end of 2022. And we were looking at how many of those were admitted to critical care, why they were admitted, and what the outcomes and what support needed when they were in critical care. Obviously this is a small study and further work is needed, but broadly what we found is that just over a quarter of patients required admission to critical care. Of those patients, the stays on the whole were short, and most patients, so over half of them, were admitted just for closer observation and didn't require invasive organ support. The main reason following CAR T that patients require critical care is for infection or for CAR T cell toxicity. Now, the two parts of CAR T cell toxicity that we worry about are cytokine release syndrome, so CRS, or immune effector cell neurotoxicity syndromes, that's ICANS. We have specific grading systems for both, and the more severe the grading of the toxicity, the more likely they are to require admission to critical care. We're lucky in our hospital to have 89 critical care beds, which actually expanded during the study period. But what we showed during our research is that any centre within the UK that wishes to set up a cellular therapy programme needs to have adequate critical care provision and close working with critical care colleagues so that we can do the best for our patients ultimately. Going forward, CAR T is going to expand, cellular therapy is going to expand, as we've heard at BSH over the last couple of days, and we need to make sure that we're adequately providing those resources for support, and also that we're informing our patients of the risks adequately. So this is a small pilot study, but there's definitely more work to be done in this area, and it's great to have cross-collaborative work across both disciplines.